to all of my superintendent colleagues in Wayne County who have been working day and night for months facilitating reopening plans with their respective school communities. Nelson Kais, Soda Central School District, Michael Pullen, North Rose, Wolcott Central School District, Donald Putnam, Lyon Central School District, Donald Davis, Marion Central School District, Matt Cook, Newark Central Schools, Sean Van Scoy, Gananda, Robert Ike, Pal Mack, Mary Grace Missoula, Williamson, Joseph Syracuse, Wayne, and Brian Corey from Red Creek. And of course, our panelists this evening, Diane Devlin, Public Health Director of Wayne County. Diane, thank you so much for the incredible amount of support you have given to the Wayne County schools with our reopening plans. Thank you for your ongoing patience and availability to answer questions at all times of day and sometimes at night. Before we move on with the program, I just want to explain the nature of the forum-style presentation using Zoom. There will be a number of slides that will be shown and information shared by Diane Devlin specific to those slides. I anticipate that many of the questions folks may have will most likely be answered during the share out. At the end of the presentation of the slides, there will be an opportunity to use the question and answer box to ask questions or seek clarification as needed. So I've mentioned this before. I'll never forget the date, March 13th, 2020, which happened to be Friday the 13th, of course. That was the last day that we had students on campus for what we all remember to be a normal, traditional day of school. We received the governor's order that all New York State schools would be closing for the rest of the school year, and that by Wednesday of the following week, July 18th, we'd have to implement a fully virtual schooling model, including providing meals, a learning plan with adequate technology, connectivity, and materials for all students. As you know, we did the best we could under those circumstances, and with very limited time, we had to pull it off. Was it perfect? Not by any means. Did we try to adjust along the way and take note of improvements that could be made if we were finding ourselves in a similar situation in the future? Of course. Did we hope and pray that we would not have to be in the same situation? You better believe it. Well, fast forward to today, and we are sharing with the school communities our reopening plan. First off, please note that every district is unique and that reopening plans are specific to the needs of each district and their school community. What Lyons may be doing could be drastically different than what Wayne Central is doing, or Williamson, or what we are doing in Clyde Savannah. I can tell you, however, that the one constant in all of our reopening plans are the measures that we have in place when collaborating with the Department of Health based on potential situations that may arise. This includes our COVID-19 protocols, the local health department procedures, isolation versus quarantine, and contact tracing that may be needed as a result. So at this point in time, I'm going to turn the program over to Diane Devlin from the Department of Health, and she will go through the slides that we have. Thanks, Diane.
Hi, thank you, Superintendent Hayden and the rest of the superintendents for the Wayne County School Districts. We've been working quite a bit since the middle of March together on different avenues and in our response to COVID-19 and prevention of. So today I just would like to share with everybody what the health department does work on in regards to COVID-19, how we will be assisting the school districts. So part of this discussion, we will be discussing the COVID-19 protocol that has been set up by the New York State Department of Health, what the local health department procedures are, isolation versus quarantine for symptomatic individuals, and what contact tracing will look like. So you can go to the next slide, please. So the COVID-19 protocol is based off of the interim guidance from the in-person instruction at pre-K to grade 12 schools that was released by the New York State Department of Health back in the middle of July. This guidance was also part of the guidance released to the schools for them to submit their plans. So within this guidance, all of these different bullet points in the next couple slides are basically stated through here. So I'm just going to go through a few of them so that and explain a little bit more on each one of them. So each school must notify the state and local health department immediately upon learning of a positive COVID-19 test among students, the faculty and staff, and possibly any visitors that come to the school. However, there may be times that the health department may have the results sooner than actually the school, but if not, then the school is obligated to call us to let us know that they've been notified of a positive test. This could happen based on the family being notified already and the family calling the school. The schools do not get test results sent to them directly. They come to the health department. So that information does not get sent directly to the schools. Schools must cooperate with contact tracing, isolation, and quarantine efforts from the local health department. Each of those efforts are conducted by the whole local health department, and when we have need to obtain different information, we will be contacting the school to obtain contact information for different individuals. Any individual who's exhibiting symptoms of COVID-19 during a screening must immediately separate from others and return home. So when I speak of an individual throughout this presentation, I'm speaking of a student, I'm speaking of a faculty member and or staff. So during the morning screenings for different staff and also the periodic screening for students, if there's anybody identified with having signs and symptoms of COVID-19, they must be sent home and told to isolate until further notice. For an individual that cannot return to school without, at minimum, after they've been sent home because they're symptomatic, they need to go see their healthcare provider and receive documentation that they've been evaluated by their healthcare provider. And then they also need to have a negative COVID-19 test, and their symptoms need to be resolving. If an individual receives a positive COVID-19 diagnosis, that means they received a test and it came back positive, the individual must be released from isolation before returning. The local health department, meaning Wayne County Public Health, would be the ones releasing an individual from isolation and letting you return to school or to work. So the next slide, please. If a student presents with symptoms requiring a visit to the school nurse, that means throughout the day, and this could also be for staff and faculty. The LHD, we recommend that the student and or staff or faculty immediately isolate and be sent home as soon as possible. And then they go through the previous slide steps as in reaching out to their doctor and seeking medical advice. School districts should continue to rely upon the guidance of their medical directors. If that means they don't need to be reaching out to the LHD to provide, to get medical guidance, they should be seeking their medical directors. LHDs will support the schools in complying with New York State Department of Health guidance and recommendations, and we'll be sharing any information or any changes throughout the whole school year if any changes do occur. And schools should follow New York State workplace guidance for faculty and staff members who are seeking to return to work after a suspected or confirmed case of COVID-19 or after having close contact with a person with COVID-19. So next slide. So as a local health department, we deal with COVID-19 confirmed cases. So we do lead these case investigations. There is a whole protocol that we have to follow. So when we identify an actual positive case of COVID-19, we then ask that case any contacts that they may have come in contact with. We do isolation and quarantining, and we release individuals from isolation and quarantine. The LHD will respond and perform thorough investigation, including contact tracing with cooperation from the school. So when we identify a positive case, we will be reaching out to the school superintendent and the school nurse to let them know of the case. And also, however, that will not happen until after we notify the specific individual and or the family of the child that they are positive and that we will be speaking to the school superintendent and the school nurse. By doing this, we are looking for the actual contacts to any of the students and or faculty that may have come in contact to the positive case so that we could adequately put them under mandatory quarantine for 14 days. And then we will provide recommendations to the school regarding action plans. So whenever we identify a positive case, we will be working with the school specifically regarding the actual situation of the case to move forward in what needs to happen, whether or not the school needs to close down and or classroom and specific cleaning guidance, et cetera, et cetera. Next slide, please. So whenever we identify a positive case for COVID-19, we will not disclose any personal information. We will notify the relevant parties, such as the person who was positive and the school superintendent and the school nurse. We will not notify anybody else within the school community. However, we will work with the school to help them notify the community if a student tests positive, and when that happens, we will only name the school building which is impacted, meaning where the school, the student attends. And if it's a faculty or a staff member that tests positive, we'll assist the school in notifying the community what school district is impacted by that announcement. Again, any of these announcements will not release the name, address, or any personal health information of the individual who is testing positive. It'll just be a general announcement that an individual has tested positive within the community. It could be just an announcement to your school population through your robocalls or a school letter. Any announcements made to any news media or anything like that would be done in conjunction with the school, and most likely would only happen if there was an outbreak situation. Next slide. So when we're dealing with symptomatic individuals, which could be a child, a teacher, or a staff member, and a symptomatic individual means someone who is exhibiting signs and symptoms of COVID-19. So for this scenario here, I'm just going to go through if an individual is symptomatic, meaning showing signs and symptoms of COVID-19, but they have not been tested. An individual is not mandated to be tested for COVID-19, but it does help rule out any other type of illnesses and such. And so therefore, if you are symptomatic and you are tested, you could come back to school sooner. But if you're not tested, you need to stay home and isolate within your home for 10 days. And that 10 days starts from the onset of symptoms. And you need to be seeking a medical provider and see if the medical provider feels your signs and symptoms as a possible COVID-19 infection. The health department will monitor your health status twice a day for 10 days. This could be done via telephone call. It could be done via video chat or Skyping to make sure that you are doing well and also staying home because you're not allowed to leave your home. And an individual can return to school after their symptoms resolve. They have no fever for 3 days without medications. They've had a negative test result, and the health department will release them from isolation. Next slide. So if we have a symptomatic individual who is tested and their test results come back negative, then they can return to school because that means that they are not actively infected with COVID-19. However, if their test results comes back positive, then again, they must isolate for 10 days from the onset of their symptoms. The health department, again, will monitor them 2 times a day for 10 days. And again, they cannot return to school until after symptoms resolve. No fever for 3 days without meds, and they are released from isolation from a health department. So for this situation, if they've already received the test, so they do not need to have another test in order to return to school. Next slide. So whenever we have a positive case, we have to identify the different contacts. So when we identify contacts, they need to quarantine. So a contact is somebody who has been in close proximity to a positive case. And the contact must quarantine for 14 days. The reason for this is because any person who has been exposed to COVID-19 can develop the virus between days 2 and 14 after their last exposure date. Individuals who are under quarantine will be monitored by the health department 1 time a day for 14 days. And this could be done either via text message through a state system, or it could be via a telephone call by the health department public health nurse. If a contact throughout their 14-day period becomes symptomatic, then we seek testing for the individual. And if that test comes back positive, then the individual actually becomes a case, and we start the whole process all over again, and we isolate the positive case individual, and then we seek out their contacts. However, if the test is negative, then the individual still needs to continue to quarantine for the remainder of their 14 days. They cannot be released to go back to school after that negative test because they could still develop the virus between days 2 through 14. So any contact to a positive case has to remain on quarantine for the full 14 days after their last day of exposure to the positive case. And the next slide. So this is just the health department's contact information. We are open Monday through Friday from 8 a.m. to 4:30 p.m. We have a general email contact at wcph@co.wayne.ny.us, and you can feel free to contact us through that way or by calling us. We do have an after-hours emergency number, so if you need to speak to somebody for an emergent need that cannot wait until the next business day, then you can call the 946-9711 number at the sheriff's office. Just be aware that they will answer the phone saying 911, so just tell them that you need the public health nurse that is on call. And that's all I have, so I'd be happy to take any questions if you have any.
So Diane, thank you for really getting into the specifics of the protocols that the Department of Health will implement and how we will be in collaboration with the Department of Health. I'm wondering, because I do get a number of questions, and if you could just review again for clarity, so if a student goes home, we may have students in any given year, allergies, there may be fevers, there may be things that are just normal sicknesses that occur in the fall and the winter in a normal sick season. What's the protocol that you're recommending for the involvement of the health provider, the child's pediatrician or family health provider, and how is that? What is the collaboration that the provider has with the Department of Health?
So yeah, each child that goes home with symptoms should be seeking out their medical provider to further get guidance. However, it is a lot of the signs and symptoms of COVID also go along with signs and symptoms of the general flu or asthma, any other chronic diseases that a child or a faculty member may have. So that's where it's kind of, you're wondering, is this actual possibly could be COVID or not? But in regards to the the New York State Department of Health guidance, they state that any individual who's exhibiting signs, even if they possibly have signs and symptoms from a previous illness, should be getting a positive test done. Thus why the guidance is written the way it is. It's not a positive test, excuse me, a COVID test conducted. So that would then at least rule out that whatever signs and symptoms they are having is not COVID or is COVID. So, but it is very, anybody who is having signs and symptoms of COVID should be seeking out their medical provider to get further assistance with any of their symptoms or not. Mm-hmm. But it does not take away the need for a negative test to come back to school.
Okay. And then another question that comes up, and then I'll go to the questions that are on the Q&A. We'll get through some of those, is the time frame and the turnaround time of a test. In some cases, it's taking, we're hearing in anywhere from 7 to 10 days or even more. How does that play into trying to get a test result so school districts can quickly do contact tracing and minimize additional exposure, or be able to isolate those students or staff that may have been at risk for potential exposure? Are we in what is that health department doing at this point to help expedite the turnaround of testing?
Unfortunately, we have no control over the turnaround of testing. It depends on the lab that the test specimen is being sent to. If it's going to be sent out of state, and depending on the volume that is sent to that lab at that time, the test results could be as long as 7 to 10 days away after the test being conducted. So the reason why anybody who is symptomatic that is waiting for a test, they should remain on isolation until those test results come back. And so therefore they cannot return to school. And in isolation, that means they need to be in a separate bedroom, try to use a separate bathroom if at all possible, thorough cleaning after the bathroom if it is shared, and wearing a mask around anybody if they do come in contact with any other household members, but they really should not come in contact with anyone at all until their test results come back. However, some places, some of the urgent cares, their test results are coming back quicker. And again, it's a hit and miss based on whatever day and whatever test volume is coming into that lab at that particular time when the specimen is delivered to it, is how soon you're going to be getting your test results. But again, people should be isolated until their test results come in. And in the meantime, while we have somebody who's waiting for test results, the health department is looking for those results on a daily basis, several times a day in a system that we can get the results. but the school could be working on any individual who is home waiting for a test results, could be looking for the contacts for that individual, so that if we get a positive test back, we could immediately reach out to those contacts to that positive case and put them under quarantine.
Okay, very good, thank you. So you just actually answered a few questions that were on here. One, what we just answered, if the symptoms don't align with typical COVID, must they still get an invasive test returned to school? So again, what I'm hearing is that folks should contact their provider. They may determine whether or not a test is needed and then go from there, and obviously would be in contact with the Department of Health. There is one question that's coming up here, and this is a question that I've heard before. We may have individuals that live in other counties. So for instance, someone that lives in Oswego County but works in a Wayne County school, and kids go to that Wayne County school. If someone in the family were to test positive, would they need the okay from both the Oswego and Wayne counties?
No, just Oswego County. It's the county that they live in. But for you to return them to work, you need to have that information given to you, meaning doctor's note and test results. So that doesn't matter what county they live in, but it would be the county of where they live that would be covering their case investigation, their contact tracing, and all that.
Great. And the child that may not be tested, a doctor or physician doesn't feel that it rises to a test, but the symptoms are gone, let's say the next day. What is a protocol for that student returning to school?
Unfortunately, the state guidance says they need to have a doctor's note and they need to have a negative test. We're waiting for more guidance to come from the state, and we're hoping that will get clarified. And there's supposed to be more guidance coming out for actual medical providers dealing with children in these circumstances. So right now, as the guidance written, they need to have a negative test in order to come back.
Okay, thank you. And a question comes up when we refer to 10 days for isolation. Is that 10 calendar days or is that 10 school days?
10 calendar days.
A question also coming up, and I hear this often, what would be considered contact? More than 10 minutes, less than 6 feet, with masks, without masks, a combination of them? I'm sure you're getting that question a lot.
Yeah, so there's a lot of circumstances. So that's where when we go in to do our contact investigation, we actually will look at what is considered approximate contact or a true contact. A true contact is anybody, what we go by, anybody having contact with a positive case greater than 15 minutes. High risk would be with somebody who is not wearing a mask, meaning both parties not wearing a mask. A high risk would be within 6 feet. So, and then you have the medium risk and a low risk. Low risk is if everybody's greater than 6 feet apart and everybody is wearing a mask. So we look at those situations and determine with the assistance of the state health department as to who should we be putting under quarantine as for contacts.
So in a sense, if it was determined that we feel that a classroom may have been in contact under these circumstances, and we want to quarantine or isolate those students. So let's say they're in isolation, waiting a test result for the individual that may have been exposed. That comes back negative. Are students able to come back to class, and what is the release for that? Is that the Department of Health that will release those students to come back to school?
Yes, if we're aware of it. If we knew that they had a test and are aware of it, we could, assist with releasing them. But all they have to do is provide you with the negative test result and provide you with information from the doctor to return.
Okay. Another question, what happens if a student tests positive? Will anyone in the immediate household need to quarantine?
Yes, because you are going to be definitely unprotected, and having unprotected contact with the individual, meaning I'm sure you're not going to be wearing masks with your own children or your spouses and stuff like that. So yes, immediate household, people living within the household will have to quarantine for 14 days. So.
Okay, thanks. There's a question that comes up, will a student who has to quarantine be able to continue doing schoolwork remotely if they're feeling fine? That's something that I'll suggest those individuals contact your individual school district principal or superintendent, and they'll be able to answer those specific questions regarding the protocol for remote learning in those situations. Okay, let's see. Again, we have a number of questions. What about if a parent tests positive? So we have a number of kids that have parents, and obviously, and if they test positive, what should we do with the child?
The child would need to be quarantined at home, but any other students at school associated with that child is not of any concern. They're a contact to a contact, so there's no quarantine needs for any other teacher, faculty, or student at school associated with that child that has a parent that tests positive.
Okay. Another question that comes up, how many people need to be infected to qualify as an outbreak? So, this is a question that we all wonder. We're hoping that we will start school. Our numbers in our region are pretty low. I think we're fortunate enough to be able to have low numbers to start school. But let's say there's a spike, maybe it's called a spike or an outbreak. And at what point would the Department of Health determine, okay, we're at these particular numbers and we need to close school or do a closure for a period of time just to get a handle on quote unquote an outbreak or a spike?
So that would be done in determination with the state health department. We would not make that determination to close a school without their guidance and also having, communication with the school superintendent and the school board. In other communicable diseases, usually the trigger point is 10 cases, but with COVID, it might be much less than that. And if we have to close a school because of an outbreak, we might have to do some mass testing of students also. So that again would be decided upon by the state health department.
Okay. There's a question here. If a child is ill, where are they sent to wait for their parents to pick them up? Will they be isolated instantly? Again, that would be a question specific to your specific districts on what their protocol will be. The guidelines clearly state there's an isolation room that buildings need to have. So I would just, for that, check in with your individual school districts on what those procedures will be specific to those districts. Okay, and again, a number of questions regarding what would be considered exposure, what would be considered contact. We've answered those. How do we navigate seasonal allergies? Again, I know that we kind of discussed a little bit where there may be symptoms that are similar to that of COVID. It's hard to tell, but we will have students and staff that have seasonal allergies and they have the sniffles and they have runny noses, sometimes itchy ears and everything that goes with that. Again, can you just clarify what we would expect to deal with those kids?
Yeah, well, it's kind of like we did back in the spring. When COVID first hit, we had a lot of individuals who would normally have seasonal allergies, and the medical providers took them out of work for 14 days or 10 days to isolate or quarantine it, or had them tested. So again, these are signs and symptoms similar to COVID-19. So therefore, the individuals would have to have a doctor's note to return to school and a negative test, unfortunately, as it stands right now with guidance from the state health department, because they would want to rule out COVID. So that's the ultimate goal for having that negative test, rule out the COVID. And so therefore you're protecting your household members and also other school population in itself.
There's a question regarding the temperature taking. Our districts are required to do temperature taking before coming to school.
So yes, so faculty and staff, I believe, are supposed to have that done upon arrival to school. However, students, the guidance recommends that that is conducted at home prior to coming to school. And I believe each school district may have a different way of dealing with that in their plans. So I would suggest reaching out to them in regards to that. But if anyone has a temperature of 100.0 degrees Fahrenheit or higher, they should not be attending school.
Okay, we have again some questions regarding the time frame for receiving testing results. We're hoping to get it sooner than a week to 10 days, so that would be great if we can expedite those. That would be a tremendous help. Let's see. Diane, we have a comment and a question. Thank you for your time. What would you say to teachers or parents that are sending their children who might be nervous about coming back to school?
Well, that's a good question. So I guess the biggest prevention for COVID-19 is wearing your mask. So being diligent about wearing your mask, washing your hands, and socially distancing is going to protect each student from others and from others from them. So, having a really good supportive conversation with them and what it's going to look like and what school's going to, it's going to be different. People are going to be 6 feet apart. You're not going to be able to group with your friends as you normally have in the past. So I guess having that conversation with them prior to school starting, and ensuring them that the school is there to assist them and try to maintain their health and safety throughout the day. And it's just constant reassurance and listening to this, to your child and to their concerns or fears.
Mm-hmm. I totally agree. So this is really a great question. From a regional standpoint, Department of Health standpoint, is there anything in place to help with either medical costs, free or low cost medical providers? So can individuals go to the Department of Health or for support in regard to testing or other services?
So we do not provide testing here at the health department, but there is a federally qualified health center called Finger Lakes Community Health. So if you do not have a medical provider or if you don't have health insurance, they do accept new patients, and they do a sliding fee scale for their services. There is free testing if you go to the New York State Department of Health's testing site at the MCC campus. However, you do have to have an appointment for that. So you'd have to go on the New York State Department of Health website to register for an appointment for that. And if there was an outbreak situation and we had to do mass testing at the school, the test would be provided for free anyways. There would be no charging of an individual or the insurance of a child. However, that if there's anybody who has ever been isolated or needs to be quarantined and they're not able to get out and get their own groceries and things like that, then the health department has to assist with those needs. So we would either seek out other agencies that could possibly help with that, or we would ask if you have any support services amongst your family that can assist with that. And if not, then we as a health department will go and get your groceries and take them to you and all those type of things. So it's a case-by-case basis, and we do what we need to do to make sure that you can safely stay home, isolate and quarantine, and not get out and expose others to the virus.
Gotcha. There was a clarifying question here, just a confirmation that we're only putting students or staff on quarantine after a positive COVID test. As they
Correct.
read or hear, the policy sounds like no one will be under quarantine or have contact tracing done unless a test comes back positive.
Correct.
That's okay. Okay. Again, a lot of questions regarding what happens to the classroom, the participants in the class, if there is a potential exposure or a positive case. So I think we've answered that. There's a question regarding the supports the Department of Health may be giving school districts in regard to providing additional PPE if needed. I can say that all of our school districts have been stockpiling a number of PPE items, and we have been fortunate to be able to do that. So I know that the Department of Health has been able to help districts out. So again, that would be unique to each district, and they should probably reach out to the Department of Health if they are having a difficult time securing any of these items. But I can tell you that we have many items in stock, so we're fortunate to be able to do that. Question comes up, will parents be informed before their child is tested when worried about an outbreak in school?
Yes. Yes. So if there is any child that needs to be tested or for any reasons because of an outbreak, there would be communication from the school home to those individuals' families that, need to be notified in regards to that. Yeah, the parent would have to consent for their child to be tested. And again, even if there's an outbreak, if the family does not want the child tested, they're not mandated to have it, but they would still be isolated or quarantined, depending on the need.
Great. Question comes up. What will be the procedure for entering school? Will there be non-contact temperature screening upon entry? Again, that's something that you would want to refer specifically to your district's plan regarding those types of screenings, temperature screenings, and protocols for home screening and procedures for entering the building. That will be specific to each school district. Great question here as well, and these are all great questions. I just said that, so don't take offense if that. I'm not saying that every question is great. They are. If a child has or starts to have signs of an asthma attack, because we do have a number of students that have asthma, severe asthma, and they could be in respiratory distress, do they have to be sent home and have a COVID-19 test? I would assume that that would be, again, contacting the health provider to see what the next steps are.
Yes. Yes, and again, because the signs and symptoms, shortness of breath and all that is the same as COVID-19 as the guidance stands right now, a negative test.
Again, another question, if someone in class was with someone who tests positive and is required to quarantine, does that mean our entire household has to quarantine?
No, just the student. The entire household does not need to quarantine.
So there may be some cases, Diane, where we have children who have certain medical conditions that may require them not to wear a mask. Can you talk a little bit about what those may be and how we can address those students that can't wear a mask?
Right. So the guidance states that students that can't wear a mask should have something written from their medical provider stating that. I'm not sure if the guidance states that the actual written directive saying they cannot wear a mask needs to state what the actual reason is. But in order for a child to have permission not to wear a mask, or even faculty person, they need to have something in writing from their medical provider stating that they cannot wear one. There could be a multitude of reasons why. So,
sure.
Asthma could be one of them.
Is the Wayne County Department of Health and your contemporaries in the other counties studying some of the COVID-19 infection data from other schools in other states who have already reopened?
No, but the state health department is. So we let them do that, and then they push the information down to us. We are way too busy to try to be able to do that, unfortunately. And some of the smaller counties, such as ourselves, we don't have large staff. I mean, large numbers of staff, such as like Monroe County, that may have epidemiologists doing that. But here at the health department, we are unable to do that, unfortunately. We keep our ear on the media and to hear about what's going on, but to conduct extensive research on it, we have not been able to.
It seems like there might be an influx of testing that is required. So we have kids that are coming back to school. There may be a need for additional testing that we'll see. What is your, are you anticipating that we're going to have enough tests in the area? Are you hearing, of any shortages that are coming, or what is your level of confidence on the availability of testing?
Right. I'm not hearing so much about testing, meaning swabs being an issue. Right now in my health department, in a closet, I have 3,000 testing swabs. So I think we'll have a good start for that. And the state would definitely be providing us more if we ended up having an outbreak and needed to do a large testing event. The one issue that we have sometimes, especially when we have to send test results, specimens out to an out-of-state lab for processing, is that some of the, and also in some of the labs within the area, is that they don't have enough reagent to run the test. So that sometimes comes up. Right now, I think we're in a good shape in regards to that, but if we start having a large insurgence of positive tests, or a lot more illness going on in the fall, for example, when schools start opening and more tests being done, we could see another shortage of reagent happening to where we just can't run as many tests because there's not reagent to run it. So right now we're doing good, but it could change in the fall.
Diane, our plans in place, we do have the isolation rooms for those students that may be potentially exposed. We have obviously the nurse's office as well. In the event that we have multiple kids that may come down at any point in time, one could have a stomach ache and some could have allergies and some could have, you know, any other symptoms of normal sickness. You know, there may be times where we have multiple kids down there. What are the protocols and safeguards for minimizing exposure while either we're waiting for kids to be picked up, either in an isolation room or in the nurse's office?
Well, if you can keep them separated, that's the best. Each student should be wearing the mask again. So, and also the school nursing staff should be wearing masks, or anybody else who's dealing with any of the ill students. The mask is your biggest prevention. So wearing that is the best means. You know, the guidance says try to keep the students apart from each other, try to put them in separate rooms, but we all know schools don't have multiple rooms that they could be putting students in. So if you could put up barricades in between each area where a student could be sitting, so that if they are coughing or anything, we're not having, you know, air droplets moving from space to space too easily. So putting up barriers in between each area where a student could be laying down on a cot or such, you know, sitting in a chair would be best. And definitely making sure they're having their masks on, et cetera, but and good hand hygiene. So you do the best you can, unfortunately.
We've seen many different types of masks and face coverings. Is there a certain type of mask that might be better than others at this point, in your opinion?
Well, let's see here, where's mine? You know, the N95s are ones that all healthcare providers should be wearing, especially dealing with those that are sick with COVID. However, you know, that should not be worn other than maybe your school nurse dealing with sick individuals in the school, within the school environment. But the regular surgical masks that you can get at any drugstore at this point in time, or even your cloth face masks, they're fine. And cloth face masks can be washed when they are dirty. These will last about a week, maybe two. I try to wear them as long as I can until they get a little fuzzy and start tickling my nose nonstop. But these cannot be washed, the surgical masks. But you can use a bandana tied around your face. You could, even if you don't have anything and you have an old shirt and you have to use, you know, you cut the sleeve off and use that to tie around to where it's covering your mouth and your nose. That's the biggest reason, is just to cover the mouth and nose. So
there's another question. Clarification again, using the words isolation versus quarantine. I have a few of these questions keep coming up. Maybe you could just review it one more time, a quick summary of the difference between the isolation versus the quarantine.
Okay, so isolation is for an individual who has tested positive, or an individual who is exhibiting signs and symptoms of COVID and has not been tested. They are on isolation for 10 days from either the onset of symptoms or from onset of symptoms. And for isolation, they would have to remain at home. They would not be able to leave their home. They need to sleep in a separate bedroom, not share a bed with anybody else. The best practice is to have their own bathroom and not share it with anybody else. But if that's unable, then they need to have thorough cleaning with disinfectant in between after their use of the bathroom. Wear a mask at all times when they're around anybody else, such as anybody else coming into their room. Food should be left outside their door if at all possible, and garbage could be just left outside their door in a regular garbage bag. You don't need to handle that in any separate shape or way. If an individual has to go to the doctor, then they should be wearing a mask as long as the other person that is driving them there, and then also notifying the medical provider that you have tested positive and that you need to come in and see them so that they can make special arrangements. So quarantine is for an individual who is a contact to a positive case. So by all means, a quarantine individual could actually start showing signs and symptoms as stated anywhere between days 2 and 14 of their last day of exposure. So they themselves should not be sharing a bedroom with anybody else either, in case they start having symptoms in the middle of the night. And again, they should, not share a bathroom. They don't need to be staying in their bedroom exclusively all by themselves throughout the 14 days. They can be amongst the rest of their household members, but they should be wearing a mask at all times. They could go outside and walk around on their own property, but they shouldn't be going shopping or anything like that, or walking up and down the street where they might come in contact with other individuals. And that's for 14 days contacts.
Okay, thank you for that clarification. Should children practice wearing masks to get ready to wear masks at school?
Yeah, good idea. Yeah, because they're going to be wearing it a lot longer than they would if they just normally go to the grocery store when they're having to wear it now. So yeah, having them wear it longer during the day.
So this is a question. How long do signs and symptoms usually persist if an individual has COVID-19? And is COVID-19 transmissible after signs and symptoms have expired?
So studies show that signs and symptoms of COVID-19, meaning COVID-19 is not infectious after day 10, or actually day 9 of an individual who has been tested positive for COVID-19. So if I start having symptoms for COVID-19 and then get today and I get tested tomorrow, 10 days from today out, I should no longer be able to spread the virus to another individual. But how long does a person remain symptomatic or can have symptoms? That's every person is different. Every person immune system is different in how they react. Some people don't have any symptoms at all and they are asymptomatic positives, or you could be very, very sick and in the hospital and on a ventilator for several days or weeks. So it's all based on everybody's response to the virus.
Diane, a question comes up. If you need a test, does one have to be tested in Wayne County if you're a Wayne County resident, or can that testing be done in a different county?
It can be done in any county. It's just the results come back to the county where you reside in. So it does not matter where you get tested. You could get tested in New York City and I'm going to get your results. New York City is not going to get them.
How is the Department of Health preparing for the flu season in conjunction with the COVID-19?
Good question. We're all trying to figure that out ourselves. So we're expecting guidance to come out in regards to how to deal with flu versus COVID for the fall. We expect, like it was back in the spring where we had to go through, for individuals that could possibly have COVID, we had to test them for flu first. So we're expecting that may happen, but we don't really know yet. We do flu education wherever possible to and communicate with individuals to get your flu shot. So that is the biggest message. Try to eliminate or reduce your possibility of coming down with the flu by getting your flu shot. So or reduce your symptoms from the flu if you do get a flu shot. Because people could still get the flu, but just have reduced symptoms from it. So
okay. There's a question that comes up with dishware. Should dishware utilized by the positive person, so let's say someone is tested positive, they may be quarantining at home, doing all those precautions and protocols. Let's say they're using dishes. Should the dishes be boiled? How would you sanitize the dishware?
So anything that is like a surface that's being touched by a person that is positive with COVID-19. Soap and water is your best cleaning agent. So for anything that is visibly dirty, you clean it with soap and water. So hot soapy water. And then, so for dishes, that's all you need to do. Just clean it with hot soapy water. If it's a kitchen counter that is soiled, you clean it with soapy water and then you clean it with a disinfectant. But I would not clean your dishes with a disinfectant because they might not taste very good after the food, being disinfected and then putting food in them. So just hot soapy water for dishes.
Are there any concerns for household pets in COVID-19? Is that something that you're familiar with?
There's been studies showing that there's animals that have contracted COVID-19 from an individual who is positive. So if we have individuals who is positive with COVID-19, we instruct them to stay away from their pets because each pet has got different immune systems just like humans. So your pet may actually get infected with the COVID-19 virus. And so because there's just so many question marks in regards to this, we instruct individuals that are positive to stay away from their pets also.
Okay. So Diane, I'm not familiar with all the types of testing that occurs. I'm just familiar with the nasal swab that's deep up in the sinus cavity as a swab there. Are there different types of tests that can be done? And are you aware of any that are up and coming to help, again, expedite the process?
Right now, the nasal swab, the nasal pharyngeal, which is where they stick it way up into your nasal cavity and feels like you're tickling your brain, is the most accurate test at this point in time. However, there's a lot of rapid tests out on the market, and when I reach out to different labs in the area, such as like RGH or Strong, I ask if they found any that is considered to be valid and have real good specificity. Sorry. They have yet to find one. So rapid tests are still a big question mark. The problem with the rapid tests right now that are available on the market, they are having a lot of false negatives, not false positives. That means they're saying that the person is negative when they're actually positive. So right now, the nasopharyngeal is the best test that we have available to us.
Okay. I am seeing a few more of the questions for some clarification. If a sibling is on isolation, not the quarantine, should all other siblings remain home from school, or can they return if they are not showing symptoms?
So if a sibling is home on isolation, they're home either because they've tested positive. So if they've tested positive, then the siblings, yes, they have to stay home on quarantine. If a sibling is home and is symptomatic and the doctor feels it is COVID-19 infection, but they refuse to get tested, then yes, the sibling should be staying home because we have to treat that individual as a presumed positive based off of what the doctor is feeling. So yeah, they would need to stay home and quarantine.
Okay. How long does a negative test last for? Say someone has typical seasonal allergies and gets a test and it's negative. Their allergies last for a couple of weeks. Do they need multiple tests during that time?
So that is for the point in time of when the test was taken. So that is all that test is for. It's just a point in time test. So today you could test negative, tomorrow you could test positive. So if you're continuing to have symptoms of COVID-19 and they're not resolving, such as seasonal allergies with medication that you have taken in the past for them, then I would seek out your medical provider and try to get another test done if symptoms are not resolving.
And then someone asked a question, will this presentation be recorded and where would it be available? So is Shannon Marshall from BOCES on here still?
I am. So we're talking about that now behind the scenes. We're going to get a link and have it ready to be able to be posted, and we'll share that with all the schools so they can post it on their social media and website.
Okay, thank you. Okay, so ladies and gentlemen, we're just about out of time. I want to thank everyone for attending this evening's presentation. Again, to my fellow superintendent colleagues, incredible amount of work that you've been putting into this with your own school communities. There are a number of questions, again, that we may not have gotten to today. We had over almost 600 participants on tonight's town hall, and unfortunately not every single question could be answered, but we did have a lot of questions with common themes. So I'm glad we were able to answer those, or Diane was able to answer those for us. If you do have some remaining questions particular to your school district's plan, please reach out to your superintendents, or if it's at the building level in their staff meetings, that would be appropriate to do so. And again, Diane, we really appreciate all the work that you put into this, not only supporting school districts, but supporting the community as a whole in dealing with normal Department of Health responsibilities on any normal time, and especially during a time of an unprecedented pandemic. So you are certainly an invaluable resource to our school communities, and we really appreciate your time. Again, I want to thank everyone for joining tonight, and I hope everyone stays well and has a wonderful week. Appreciate it. Thank you.